Medicaid is called different things in different states, so it can be really confusing. If you're on a waiver, that's Medicaid. If you're in Wisconsin and it's called Badger Care, that's Medicaid. In Washington State, it's Apple Care. All those things are Medicaid. And part of why that is because Medicaid is both a federal, meaning a national program, and a state program. But states actually run it, so then they name it. So the money from the state and federal government mixed together to pay for things like home and community-based services, day supports, employment supports, residential supports, all of these things matter so much to the disability community, and it's why we have to focus on both the state and the federal government to make sure that we're protecting the program and advancing more funds so that we can do things like remove waiting lists. Part of why there are waiting lists is because the federal government, while states run the program, the federal law oversees it. And that means that the federal government sets rules about what are mandatory and what are optional services. And unfortunately, those home and community-based services that I mentioned are still optional, which means that states can cap and limit how many people they're serving, which is why we have waiting lists. So the state and federal partnership of Medicaid is so important. It's why we have to advocate at both the state and federal level. And it's part of why it's a little more confusing and why we all need to help our friends and family understand why Medicaid matters.